Hello everyone and welcome to NEET Mentor. In this session, we are going to talk about very basic and fundamental perspective of counseling, or I would say the prerequisite before we start with the counseling, branch versus college, and how to select your branch and what to prefer, college over branch or branch over colleges. There are multiple principles, okay, and I will be discussing about that in detail, and how you can see round 2 versus mop up round cutoff, particularly for all India quota this year compared to last year. Before we start with the discussion, in case you want to join the paid counseling guidance, okay, the slots are available and we are planning to close it soon. And for that, since the counseling is getting delayed and the date is not fixed yet, there is no notification from government side and there is no concrete update. You know the reasons why it's getting delayed, but in case you are not very sure that how you can proceed and what options is available to you, then you can book our paid counseling guidance by paying a token amount, okay, and the remaining amount you can pay once the counseling schedule is published. In that we will be able to tell you like which colleges in which states and based on your branch preference are possible, okay, and in which round you can get, so that you have clarity and you have peace of mind. So the duration from now until the counseling schedule gets published, you should utilize to strategize your counseling process, to architect your counseling process, and don't get confused. Okay, and you can also join our Telegram group. The description will have link for Telegram group. You can scroll to the description part and you can click on the link for Telegram group. There are already 13,000 plus members, so you can put your questions also. Now coming to the point, branch versus college selection. I received many calls, okay, since the result got published, and candidates, there are candidates who are very sure about their branch selection. They say that I want these three branches, one of these three in this particular sequence. Some other candidates are not sure. They say that this is my rank, is anything possible? I will get confused if you ask such question, because you need to be specific about your branches. It's not MBBS. There are different departments, and depending on your interest, you have to select the branches and in particular order, because there are some branches and depending on the branch selection, your lifestyle will also have to be adjusted. There are branches which requires you to be very much available on urgent basis, okay. There are so many urgent cases that you need to cover day or night. There are other branches on the other side which doesn't require you so much of time, and you can have like peaceful life, comfortable life. At the same time, you might have so much of time for your personal work or your family. So what you prefer, it all should be noted down before you select your branch. And before these preferences, you need to have like when you completed your internship, okay, when you studied, then what was your dream branch, on which branch you liked more, okay, what you are passionate about. In case you select some branch and later you regret that, okay, I should have selected other branches that my friend had selected, and my life is more comfortable in that, because all branches are not same, okay. And if you are not sure, if you're sure, then no problem. If you're not sure that where my interest is, or like which is comfortable for my lifestyle or for your characteristic, okay, what type of life you want to be like isolated, or you want patient interaction, okay, there are many points, okay. So depending on those things, you may talk to your seniors or your colleagues, okay, and you can sort out like a list of branches where you can go. Now coming to, so first you have to sort out the list of branches in particular sequence. It's very important, because when you go for choice preference filling, they ask you to select branch and then select the colleges for that branch. So you will be having unlimited options. I received this question also, that how many choices I can enter. It's not like one choice or 10 choice or 100 choice. You can enter n number of possibilities. Okay, as much as possibilities without repeating the choices you can enter, so there is no limitation. Okay, but you should not do any mistake and you should have very clear mindset. Now coming to the point, when you have sorted out the list of branches in particular preference order. Okay, and suppose pediatrics, your pediatrics is your preferred branch, or OBGY, or like ortho, or general medicine, or radio. Okay, then it comes to point when your rank is on boundary line, you might not be getting the top colleges, or the colleges where the patient flow or OPD, IPD for a particular branch will be sufficient. Okay, even infrastructure machinery is required, particularly in case of radio diagnosis. Okay, in case of some surgical branches, whether you get the surgical experience or exposure, hands on, all those points are important. Okay, but still, in case you come to a point when you may need to, you have two options: either you sacrifice your branch or you sacrifice your college preference. Then, based on like expert or senior doctor's advice, the branch that you select is going to be attached to you or your nameplate for lifelong. Okay, so I would suggest you go with your branch preference. Okay, you can manage with college selection if the college doesn't provide you that much learning opportunity, but still I would say you go with your dream branch, because since it's dream branch, you can do some additional. Okay, you can put some additional like effort for after completion of PG. You might need to struggle for a couple of years. Okay, you can do your SRship. Okay, during that time you can learn. You might need to struggle for a couple of years, but further you will be happy that you selected your dream branch and you are having very good life. Work life balance will be maintained, because every person is different. Some branch which is good for you might not good for others. Okay, so it's not like this branch is low high clinical or that branch is low clinical. It's just a term. I don't want to degrade any branch. I know people who score who got rank under 1000. Okay, and they are going for ENT. There might be reason behind it. If you have any kind of a parental structure or support, then there is no problem. You can go for any colleges because you know that you can learn it. Okay, so there are many points that you need to keep in mind when you go for selection. But I would say that you go with your branch selection and you select your branch over college. You compromise with the college quality, but still you go with your dream branch if it's available. Okay, it varies candidate to candidate. If two branches you have in your list and both are like equivalent, so you see that which one is getting best college for you. Okay, now coming to the point for all India quota, particularly MCC counseling. Last year we had seen in mop-up round the cutoff went so much low and candidate got seat they didn't expect. So this year everybody knows that in mop-up round they will be getting some kind of like jackpot. So what about round two cutoff this year compared to last year, and what mop-up round cutoff this year compared to last year? See, nobody wants to wait until mop-up round. That's for sure. First round, you know that you won't be getting the best one, but in second round you want to take the seat. You don't want to risk your chances until mop-up round, particularly for government colleges. But in case your rank is on boundary line, okay, to get clinical subjects or particular clinical branches, then you have no option other than going until mop-up round. And in mop-up round you will put your backup options also. These are some of the tips and tricks, okay, based on our experience. Okay, so we will tell like in which round what options you should have, you should fill in the choice preference. In round 2, what branches and which type of colleges. In case you are going for DNB, then what DNB hospitals you should add, so that you still have the chance to get the best possible in your rank and branch selection. Suppose you got a DNB hospital in medicine, but someone in mop-up round got MD medicine. So you should do counseling in such a way that you don't keep so much space to regret over your selection. So that's very specific, because computer doesn't understand more than what you enter into the system. So what you are entering, everything boils down, all the videos that you're watching and all the discussion, all the analysis that you're doing, all the information that you're collecting, stipend, bond, everything boils down to choice preference, because system is blind. Whatever data you put, even you have mistaken, okay, based on your rank, you have selected community medicine, but you can comfortably get general medicine, just human mistake, but they don't understand. So you have to select study all the points from all the perspective, but it boils down to choice preference. And how you do the choice preference in first round, because you will be getting option to do fresh choice filling in round 1, round 2 and mop up round. Okay, so this year you can see good cutoff in round 2 itself compared to last year. The cutoff won't be that much high because candidate, okay, and in mop up round, so it's a specific, I can't tell you in generic case that okay how it will go, but it will change who has to take the seat in first round and who has to take seat in round 2, and round 2 will be best for whom. It all depends on rank. If your rank is very good for particular branch, you can take seat in round 1. If you didn't get in round 1, then you should take in round 2, because if you don't take in round 2, in round 3 you might not be getting such good colleges. You might be getting the branch but not good colleges. So the strategy changes depending on rank, your location preference, your branch preference. Okay, with this note I'm going to conclude this session, that you should be cautious that which branch you like, which branch is good. If you're not able to decide, then consult seniors that okay which branch is comfortable, will be good for you. Okay, and how you should select your branch over college or college over branch. And round 2 mop up round cut off this year compared to last year. So thanks for watching and have a nice day.